BHALO THEKO A wishes you a happy World Mental Health Day. I'm Shavni, and today, on behalf of BHALO THEKO, I would like to talk to you a bit about psychoanalysis and mental health. I'm a psychoanalytically oriented psychotherapist, and I'm currently training as an analyst. I would like to take the opportunity to talk about psychoanalysis in an effort to spread awareness about it. Psychoanalysis was developed by Freud as a way to go beyond the biological definition of mental illness offered by psychiatry. So, before Freud, the common idea was that all our psychological illnesses, mental illnesses, have biological causes. But Freud, with his work, was able to demonstrate that that is not so. He was able to show that there exists a part of the mind which is unconscious, meaning that we consciously do not have any connection with this part of our minds. That governs a lot of our day-to-day activities, that controls how we react to certain things, that controls or that often makes up who we are. At present, there are multiple schools of psychoanalysis, all of which have their own beliefs, have their own schools of thought. But the one thing that ties all of these schools together is this belief in the existence of the unconscious and the hold this has on our lives. To understand the workings of the unconscious, psychoanalysis is a training in a very particular kind of listening. So when psychoanalysis was invented, it was called the talking cure, because literally you could reach cure simply by talking. So the particular kind of listening that psychoanalysis offers is to listen to what is particular, what is unique in each individual. Conversations that we have with other people are often based on common grounds, on the shared experiences that we have. I can understand what you're feeling only in my own way, by placing myself in your shoes. And what that does, it takes away from the uniqueness, from what makes the other person singular. How many times have we suffered when we realize that someone close to us doesn't understand us like we want them to understand us, that they do not share our values, that they are not like us? On the other hand, how many times have we said when we are ourselves suffering that no one understands us, that no one can understand what I'm going through? So when we listen to people very closely, we will often see that we are more different than we would like to believe. Our tendency to look for ourselves in others prevents us from seeing them as they truly are. Because psychoanalysis is a training in listening, it listens to the singularity of each individual. To psychoanalysis, each individual is unique. To me, by listening to this uniqueness, that is a small way in which psychoanalysis helps counter the inequality of our world. The concept of inequality requires comparison to others. And where there is no comparison, there is no scope for inequality. We know in maths that A is equal to or not equal to B. But in psychoanalysis, this becomes irrelevant because in a session, there is no B. For this reason, the distinction between normal, abnormal, the healthy and the diseased that is very prevalent in the rest of the world in mental health does not exist in psychoanalysis. Because all of these categories require a comparison, require us to reduce individuals to some traits that we can then compare them on the basis of. So because of this, you do not begin an analysis because you are diseased or because you're unhealthy and you wish to become healthy. But you start an analysis when you're suffering and you wish to seek a cure for your suffering. An analysis begins with the suffering, with misery which seems unbearable, in an effort to help us transform that into happiness. Thus, briefly, I've tried to illustrate what psychoanalysis is and what it offers.